Fadi, with All-On-4 or All-On-X treatment, can you take us through the process?
Well, the process, like any major restorative in dentistry, there's the consultation, there's the medical consultation, understanding that the patient is medically fit for the procedure. And once that's established, the next stage is the design stage, understanding what kind of All-On-X procedure. Is it a traditional type situation due to no teeth or a terminal dentition? We've got to factor in the age of the patient. There's new techniques now where we don't use the fake gum. So there's many decisions to make in terms of the final teeth that go in. And that starts with the treatment planning, the diagnostics, the smile design, all of that before anything's actually done.
Once all of that's been done, you have your surgery, then what happens?
Once all of that's been done, there's the day of the surgery. All the procedures are under general anaesthetic, whether it's in our theatre or it's in hospital. And then once that's completed, then the process is over the next 24 hours, the teeth are inserted, and depending on each scenario, whether there will be multiple sets of teeth as to get to the final desired outcome. And the initial first 3 months is where the healing and integration takes place. So there's special care instructions to the patient, very close monitoring on our behalf. We do like to see the patients quite regularly, initially at 1 week, then 3 weeks, then monthly, to make sure the hygiene, because it is a paradigm shift, so we want to hold their hand, so by the time everything is healed, they're ready, and they're ready for the final part of the process where they can take that bite into the apple or chew their favorite foods finally.
So once you've had All-On-4 treatment, is that it? You never see them again?
No. Once you've had these sort of treatments, like any patient, they're pretty much married to the practice. So we need to have a strict protocol in terms of maintenance, and we certainly do. Depending how diligent the hygiene is of the patient, it can be anything from seeing them every 4 months to every 6 months. That's something that has to be done indefinitely, and then we have to keep assessing that over the years. We take radiographs every few years. We assess each individual. The 3-year mark, often now we take off, we unscrew the prosthesis, check underneath. So we've got a whole protocol to try and increase the longevity of the appliance, maintain the health of the implants, keep the patients educated into any hygiene techniques that they're lacking, just to try and, like I said, prolong whatever treatments we do, because anything you do in dentistry is limited and it's only as good as your maintenance.
Can I ask, does it affect your speech?
It affects your speech only if it's not well designed. Speech is often related to where the teeth come together in the ideal position. Aesthetics is a big thing, but at the same time, aesthetics has to marry with function. With our years of experience and with our printed tries, the first assessment is phonetics and speech. We get a video out and start, there's a whole string of phonetic exercises that we test so that we can get the ideal length so that it's not bumping the lower teeth, there's not too much air and whistling. So there's a whole process, but again, that takes a bit of skill and experience. Certainly if it's done right, there shouldn't be any lisping. I'm Fadi Yassmin, and I look forward to welcoming you to FY Smile.